Hello, dear listeners and televiewers of Equinoxe Radio Multimedia. This is Thursday, and we know that Thursday is meant for us to discuss on health-related issues, and you are tuned to your program, You and Your Health. For presentation, I am Immaculate Fogwe. Pregnancy is different for every woman. For mothers, it's an enjoyable moment, while for other women, it can somehow be challenging because they experience a lot of sicknesses, morning sickness, maybe nausea, vomiting, and all of that. And that makes life quite difficult for some of these women. But then, how can we ensure that the mother and the baby are all well, are all fine during such difficult or challenging moment? That's what we'll be answering in the course of this program. Meet our guest in some few seconds. And of course, my co-host, our beautiful AC Lucy Liengu, is currently here with us. Hello, Lucy.
Hello, Immaculate Fogwe. Hello.
How are you?
I'm fine, thank you. And you?
I'm good. Okay.
Yeah.
So, Lucy, we are going to be receiving a midwife. She's known as Priscilla. She's a midwife at the Mbopi Baptist Hospital. It is a pleasure to have you on the program today. Madam Priscilla.
Thank you. It's a pleasure to be here on Equinoxe today. As you have rightly said, my name is Priscilla, a nurse midwife in Mbopi Baptist Hospital. I also serve as a supervisor of nursing services for the hospital. Thank you.
So, today we are talking about pregnancy, and we are quite aware that this is one of the best moments of every woman who wants to have a baby, and we know how challenging it could be for some of these women. But then before coming to that, what are the early signs of pregnancy and how can it be noticed?
Thank you. Pregnancy is joyful, as we have said. There are signs that we are going to see today. First and foremost, before a woman is even thinking of a pregnancy, she must have missed her periods. The day she was supposed to menstruate, the menses do not come. And if they do not come and she has had sexual intercourse, there is high suspicion of pregnancy. So the signs are in various stages. Earlier on, what you can suspect after a missed period are what we call presumptive signs. They come gradually. They may start, after the missed period, you have tingling at your breast. The breast become very tender, especially at the nipple. Once your finger passes around the nipple, they are very, very, very tender and even painful. And as days are going, there is nausea, there is vomiting. And she starts being worried. Anxiety starts coming in. And gradually, you feel a type of bloating in the abdomen, and you are wondering, my abdomen, my intestines are not functioning well. There are a lot of questions that they start asking. And as the days are going, they come on now what we call the probable signs. Probably, I may be pregnant. And what are they? Now, the uterus is not more as its normal place. It has started enlarging, and frequently you are going to urinate. Because the uterus and the bladder, they are neighbors, as we always call them. Because the uterus is enlarging, it was usually very quiet. It now starts irritating the bladder, and so you start going to urinate time and again. And by vaginal examination, as a midwife would do, a gynecologist, we will have one sign that is called ballotment. When you insert your finger into the vagina, you are able to make the uterus to bounce like a ball. That is a ballotment sign. You are already seeing that there is something in that uterus. And there are some changes too around the vulva, where the vulva and the cervix, what we call the Hager sign or the Chadwick sign. These are signs where, because there's increased discoloration at the labia majora, the clitoris, into the vagina and in the cervix, they become darker because there is increase of blood supply into those areas. Those are some of the signs. And at a home level, a woman might just get a strip and want to do a pregnancy test. That is still probable. And then I will go to the real, that she is pregnant, a positive pregnancy pregnancy test, which can be done at the laboratory, but there's still a question. Something needs to confirm it. The fact that laboratory has said, okay, pregnancy test is positive, does not conclude. You confirm by doing an echography. Because the hormone, known as human chorionic gonadotrophic hormone, can be positive. Meanwhile, it's a different condition. So to confirm that this is a pregnancy for real, echography has to come in. When they not check the uterus, and then they see that there's a growing fetus, and so there's a pregnancy there. And if it is already more than 12 weeks, the fetal heart can be getting. Echography gets a fetal heart at 5 to 6 weeks, but by a Doppler, this hand apparatus that we hold with the hand, from the 12 week, you can get the fetal heart bouncing, and then you now confirm that true, this is a pregnancy. So those are the signs that you get while you are pregnant to make you know that, yeah, there's a pregnancy here.
Now, is there a possibility for a woman to be pregnant and still see her period?
She should not.
Okay.
But we have what we call implantation bleeding. This comes around 7 days after conception. When fertilization must have taken place, and now the growing fetus now moves now from the fallopian tubes into the uterus and start implanting to later on form what we call the placenta. Those chorionic villi that are implanting into the placenta wall, they may cause some bleeding, which is not in every woman. Some women have it, some do not have. But later on in pregnancy, after 13, 14 weeks, if she starts bleeding, we start having a worry. What is the problem? The pregnancy might be, she might be losing the pregnancy already. But if later on, after 20 weeks, she starts bleeding, we start thinking of placenta previa, a case where the placenta is inserted into the lower segments of the uterus, which tend to bleed. So those are the various reasons. So when she bleeds, we go research.
I see.
Yeah.
So now, what is the purpose of a prenatal care?
Prenatal care is very important. WHO advocates it. Even our nation has an algorithm for it. Very important because this is a life of two, the mother and the baby. Prenatal care is a period of surveillance, supervision. You are seeing to it that this woman carrying this baby carries it to term. We know that it's a period of 40 weeks. So it's quite long. And 9 months is more than half a year. We want that she should carry this pregnancy without complications and deliver safely. So it's that period of supervision. We are supervising, checking about infections and treating, giving immunization for for tetanus so that she shouldn't get infected. And also, we are also checking the fetus. Is this fetus growing well? What about the morphology? Are they 2? Are they 3? Are they 4? And then we plan their visits. Normally, we have 8 antenatal visits, which are very, very important. As we are checking, we are giving rendezvous. So it's a moment of education also. Women get educated, a lot of education during their antenatal visit on their hygiene, on their nutrition, on their activity. All these are given at the antenatal care. And any infection or any problem that's diagnosed will be treated, or those ones that need to be followed up. When baby is delivered, this and this has to be done. That is what we do at antenatal care, which is we encourage every woman to come to the antenatal care. Even after a missed period, that first month come. But if most of them would not come, so majority come at 3 months. When they are so a bit sure.
Yeah.
You mean immediately as we miss our period,
when you
just
miss
come?
your period, come.
Okay.
Yes, we will tell you, because a pregnancy can be diagnosed 8 weeks after fertilization has taken place.
Okay.
Yes.
But nurse, we know that some cases, some girls don't really go to the hospital immediately because they believe that their period, the dates might change. So even if it's after 1 month, they know that maybe there is a delay. We know that some girls who consume this contraceptive that actually delay their period. So if they miss it for a month, they might not have the notion or the sense to visit the hospital.
Actually, missing a period, as I said, does not conclude a pregnancy. If you miss a period when you are sexually active, that would be a first suspicion.
Sure.
But when you miss a period and you come and there's no pregnancy, some will rejoice, some will cry, because some people missing that it's not pregnancy is bad news for them. Some will be happy, but it's always good. That's why we want all women to be very much alert. How is your system?
Okay. So for you to participate on today's program, you can call the following number: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Back to you, nurse. Do all pregnant women have weird cravings?
Actually, not all, but majority.
Like
And
saying,
what
I want
is-
to eat bushmeat at in the middle of the night at 2 a.m. I want to eat plums. I want to eat dog meat. Are they exaggerating?
There is a craving
Okay.
that can sometimes even be craving for things that have no nutritional value.
Wow.
That one is already the exaggerated form of craving, and we give that a name. We call it pica. It was from a bird it's a Latin word. They call it pica. It's a bird that picks everything.
Okay.
Picks everything and eats. So this pica, as we call it in midwifery, is common in pregnant women and children. We know that children eat everything.
Yes.
They don't
yes,
select.
Yes.
So pregnant women fall in this, they become victims of this pica. When they have pica, it is actually a very difficult situation to cut it.
Wow.
Because they start loving things like our Cameroonian women. Calabacho, they want to eat chicken every moment. Some are sucking bonbon, a packet of bonbon. So they don't eat but biscuit. They must only eat but this particular biscuit. So when
We have a call on the line. We'll get back to you on that. Hello?
Yes, please. I have a question, please.
Go ahead, sir. Your name, where you're calling from, and your question.
Okay, Taiwan. Calling from Yaoundé.
Okay.
So my question is, how many days normally does a woman supposed to flow?
How many days?
Normally does a woman supposed to flow? Is there a specific number of days that a woman to menstruate? That, I mean, the least, is it the maximum days and then the least days? That's what I want to find out.
Okay. Yeah, he's
Thank
talking
you.
about menstruation. I think it's different from pregnancy, but I think you can attempt an answer to that.
Thank you very much for your question. Menstrual flow ranges from woman to woman.
Yeah.
There are some women that their normal menses is 2 days, 3 days, and there are others that go to 6-7 days. Each woman has gotten a pattern. So each woman knows her pattern. So that when this pattern is deviating from her normal, she needs to consult. If you are a woman that has been bleeding only 3 days, and suddenly you are bleeding 10 days, you are worried. So it ranges from person to person. It is not a standard.
Okay. And now, is it safe for a pregnant woman to carry out physical exercise?
Exercise is one of the things that we teach to pregnant women.
Okay.
Pregnant women, they should not just sit on one place, sedentary life. No. We tell them to do exercises. She should be able to cook. She should be able to clean around the house. She can swim. But we have limitations. We tell them not to split firewood.
Okay.
Those hard work. We tell them not to play football. But she can joke around. If she's the one that loves bicycles, she use a bicycle that is on the spot. And then it is just rolling and exercising her. Exercise is advocated in pregnancy. You don't sit on one spot. You must do something. But some conditions, the doctor will tell you, no exercise for now. You might be having a lung problem. You will not be breathing well. They will say you whole exercise. You have cervix. You might be incompetent. Doctor will tell you whole exercise. Wow. So there are a whole lot of issues that they limit exercises. But majority of women, they are very stable. They can do exercise.
Then, nurse, what about ironing during pregnancy?
Ironing is one of the exercises because you got to stand up.
Because we talk about the heat. They say the heat is not good for the stomach, for the baby.
If heat has to be a problem, it should be where you are exposed to open heat.
Exactly. In
and
the
you
kitchen,
are cooking in this very large
ironing.
fire like baking. We will not advocate that, but ironing is just gentle exercise that the woman can do sitting or standing. So ironing is has no
But in
problem.
some cases, there are some women, from what some women also women that have had who are pregnant, they are asked by the doctors to cover their stomachs with maybe a tampon or with the heavy cloth or with the blanket while they are ironing. Why?
That will be the doctor's advice. You know, from the nursing point of view, we should be able to assess how much heat is there, because we know that too much of anything is not good for anybody, plus you and me.
Mm-hmm.
Yes, if we are exposed to too much heat, we have all the risks. So we tell the woman, you do your ironing normally, but it should not be excessive heat, that you are finishing and you are all broken because of the heat that is touching you and even a risk of affecting the baby. That's what I can say.
We earlier talked about cravings, and now we know there are some women due to these cravings. We have another call on the line. We'll take this call. Hello?
Hello, madam.
Yes, sir.
Okay.
Good afternoon. Your name, where you're calling from, and your
madam.
question.
Yeah, I'm calling from Buya. I'm Mr. Prince.
Okay, sir. Go
There's a
ahead.
question I want to ask about antenatal.
Yes, sir.
Yeah, because there's a phenomenon I've noticed about mad women who get pregnant on the street.
Mad women,
Yeah. Because they don't do any antenatal, but they give birth successfully. So is that a miracle, or is antenatal all that necessary? That's my question.
Okay.
Renette.
Yeah, he's
so I have a
pointing.
lot of cases. Yeah.
I guess you got the question. Pointing
you.
out. Thank you so much. Okay.
Thank you very much for your question. Yes, we midwives, when we see those women, we are actually worried. Actually, they carry their pregnancies, they eat anything, and then they deliver. But there are many things that are missed in such a pregnancy. Illnesses that could have been treated, they don't get treated. The baby can also inherit some infections from the mother that could have been gotten and treated in pregnancy. They are not gotten, because we are not able to trace those babies after delivery, how they are faring, because some may go and die because of what could have been identified in pregnancy. So we encourage that if it is possible, all the women should attend antenatal care. And we do have some that relatives bring that are actually not very stable, not mentally stable, and we are able to manage them. Antenatal care is important to all women, irrespective of their mental status. So, sir, if you are able to cajole them so that they come to the hospital, we'll very much be happy to welcome them. Thank you.
Okay, we earlier talked about cravings, and we know due to some of these cravings, a lot of these women gain a lot of weight. What is the required weight for a pregnant woman, and how can she limit the number of calories? I think we still have another caller on the line. We'll take this caller because it's for them that we are here. Hello?
Hello, good day.
Good day, sir. Your name, where you're calling from, and your question.
Yeah, it's Mr. Kempes. I'm calling from Kenzu. Kenzu is a border town going to Central African Republic.
Okay. Hello, Kenji. To all those living there, yeah.
I don't know, maybe I'm off topic, but I just wanted to ask from the midwife, because my wife is pregnant.
Okay.
But she's refusing sex.
Wow. Okay.
So I don't know if that question is viable. She's refusing sex, and I want sex. So I'm sorry to say it, but it's good to ask.
Okay, we'll be answering that straight away.
Okay.
Sexual intercourse in pregnancy is not refused. It is an enjoyable moment, because the vaginal floor is even softer, and it is a moment that sex can actually be enjoyed. So sex is liberal. The woman should be able to enjoy sex, but sir, the positions will have to change. Men usually like the superior position. So this woman, because of the pregnancy, and we won't like her to sleep on her back, she should go superior. So we should be able to permit the women to go the superior, or you come from behind. Sex is not limited, but some medical conditions, the doctor will say, hold on with sex for now. Otherwise, majority of our women, they have sexual intercourse, they enjoy it, they are happy with it, and it's a moment to hold your husband, because there's no fear of any pregnancy again, because they postpone sex most of the time because they want to avoid a pregnancy. But so far she's already pregnant, sex is very free and very enjoyable.
Due to time constraints, we will be able to conclude with some questions, but then we want you to give advice to some pregnant women who are watching us at the moment, and maybe they are going through a lot of challenges. What can you tell them at this moment?
If you are pregnant, be sure that you go to the hospital, where you will be followed up by the midwife and the gynecologist. Most of our health institutions now, they are having gynecologists. Okay. These two parties, they work together to see to it that you are served through your pregnancy, through labor, through delivery, and even postpartum. Up to about 6 weeks, we monitor the women. So the advice is, visit the hospital, ask your questions, receive the treatment, bring your husband along, and men, please accompany your wife to ANC. We always we give priority to when a man comes with a wife to ANC, because we know that you need to go and look for money. So we treat your wife as VIP so that you can go. Men, join the women, come to ANC and receive essential care so that the mother and the baby are safe. We are fighting maternal death, we are fighting neonatal death, and it is through prenatal care that this is achieved.
Lucy, any last word?
Like the nurse said, the midwife said, she has said everything. Women should visit the hospital early. Even when you miss your period for the first month, you should be able to visit the hospital.
I would like to stand with the midwife who said men should follow their women for prenatal care. I guess it gives some sort of assurance to some of these women, and why not to those, the staff. And that's what put an end to today's edition of the program You're in Your Health, aired on Equinoxe Radio Multimedia. We had as guest Priscilla. She is a midwife at the Mbopi Baptist Hospital. And from here to the studio, to you over there, have a lovely day.